Searching for some relief from lower back pain, and boy, we all suffer that as we get older. Brian Horner's here from Fast Track Physical Therapy. He's here with more on the causes of the pain. And Brian, you're the owner here and the director of Fast Track Physical Therapy. Banner here, common causes for lower back pain is what? I mean, there's like 4 different causes.
Well, there's more than 4, but the common ones are, well, first I want to get in, before I get into the different causes and stuff, I do want to mention, if you're thinking, heck, I wish this guy was talking about my neck pain, because that's what I'm dealing with. Yeah. So everything I'm going to talk about as far as your low back, you can correlate that to your neck.
So it's all intertwined together.
It is.
Okay.
The degenerative changes, the disc issues, all that kind of muscular issues that's going on in your low back and also having in your neck, and those types of things. So I just want to let other people know that are dealing with something different than low back pain. So the other thing I want to mention is that you can come see a physical therapist or come to our practice to get better without a doctor's referral. That's kind of a misnomer out there.
A lot of people think you have to have a doctor's referral or MRI or something,
exactly.
Then come see you, but you can come see you first.
Exactly. And most insurances nowadays are requiring you to actually have an MRI before you can go to physical therapy.
Okay, we have a little video right here.
Exactly. So anyway, the other thing I want to mention is that sometimes if somebody may be saying, hey, I've already had physical therapy, that didn't help me. I was in and out in 30 minutes, and they just made me do a whole bunch of exercises, and that didn't help me, or even made me worse.
Yeah.
That's not us. We always treat our patients for 60 minutes, and we always do utilize a lot of manual therapy or hands-on techniques, mechanical traction modalities when we need to, and those types of things. So, jumping into the common causes. So we got disc issues, or a herniated disc, or sometimes it's called a protruding or extruded disc, or some people will say a bulging disc, or even a slip disc. So all kind of intertwined terminology there. So basically what's happening is that you're going to have a bulge, would be an example like this, or potentially even a disc protrusion out here, or the herniated a disc will herniate out and put pressure on the nerve root, and that's going to cause the symptoms down the leg, or in the buttock, or just in the low back itself. Now, that person is most likely going to be less than 55 years old. Typically sitting is going to bother them, bending over is going to make it worse, and oftentimes they'll get some improvement with standing or walking, but it usually doesn't resolve the issue.
Yeah.
Okay, so that's a disc issue, herniated disc. Next thing that is a common cause of back pain is stenosis, or a lot of times patients will be told, oh, you have degenerative disc disease, or...
And that's as you get older?
Yeah, or arthritic spine, or sometimes the terminology is spondylosis. So so this is more like that. This is you, Randy.
Yes.
Okay, all right,
Yep.
So the disc space is becoming more narrowed. You get spurring or osteophytes there that could be out here by the nerve, causing irritation to the back or symptoms down the leg. This person's typically going to be over 55, not always, but typically. They're usually going to actually have worse pain with standing and walking, and actually get some improvement with sitting, okay? Not always, but oftentimes. The next common cause is pelvic pain, or sacroiliac joint pain, or SI joint pain. And that's basically, that could be a person of any age. Usually what's going on there is the pelvis is out of alignment, or the sacrum is out of alignment, and our therapists are excellent about identifying what's causing alignment issues, getting it back in alignment using hands-on manual techniques. Oftentimes we'll see the leg length off there and those types of things. So, and then the final thing is myofascial or muscular issues. So, we've all strained the muscle.
Any age.
Yep, exactly. And same thing. Again, neck, low back, buttock, whatever. So we strain muscles, we pull muscles, the muscles go into spasms, we get trigger points. So we utilize typically trigger point dry needling with that. We go in and needle it. We see extremely good results with dry needling to get that muscle to release and relax. But we also do cupping and deep tissue and instrument-assisted percussion therapy, all that kind of stuff, modalities.
And you have 3 locations?
We do. We're in Speedway, Avon, and just opened in Mooresville, and should be open in Danville by the fall. So.
And Brian, if people want to get hold of you, how can they do that?
Well, look on our website. Hopefully it's on the TV screen there. Yeah, exactly.
FastTrackTherapy.com.
Exactly. There we go. And go to there, and it has all of our locations on there and all the phone numbers on there.
All right, I appreciate that. This is Brian Horner of Fast Track, and I appreciate you coming on.
Yeah, great.
And we were talking before, and you said you've been watching me for many years.
Many years. So well back before you had Bell's palsy, I mentioned that to you. And so we treat that too.
So you can treat Bell's palsy as well. You told me that, I was shocked.
Exactly.
I mean, it's all connected.
Just had a referral yesterday for a patient with Bell's palsy. So
really? You can help them out. All right, Brian, appreciate it.
Yep.
Keep watching.